certified natural medical practitioner, and today's topic is Sibo, small intestinal bacteria overgrowth, small intestinal bacteria overgrowth. We want to find out what is really Sibo, and then the symptoms, causes, risk factors, and the complications. Okay, that's what we're going to talk about today. Well, you see, um, SIBO is actually characterized by an increased number or abnormal uh, or abnormal type of bacteria in the small intestine. Normally, there is small amount, or I would say fewer number of bacteria that should be in the intestines. But unfortunately, in SIBO, there is higher number or an increased number of bacteria that shouldn't be. The colon or the large bowels is where we have a lot of bacteria or some colony of bacteria, but they also have a purpose to be there. Naturally, the small bowels or the small intestines is supposed to house just very few bacteria, and it's supposed to be a clean place, a clean environment, and that's where we absorb about 90% of nutrients. So when you eat, whatever you eat, the nutrients, 90% is absorbed there in your small bowels. You see, when you masticate or you chew, it goes through the food pipe, and the food pipe then is connected to your stomach. That's where in the stomach you have the acid, you have the digestive juices. It mixes with the food, and then it's passed on to the small intestines. Then, of course, we have further, breakdown and absorption of nutrients. You see, we eat not because we are hungry, listeners. We eat because of nutrients. Um, Hunger is naturally a second reason why we eat. So that is the reason why whatever we eat, we have to ask ourselves what amount of nutrients are there in this food or in this meal for us. So normally, if you have a lot more bacteria in your small intestines that is unnaturally that act on the food there that is supposed to be uh, broken down and absorbed into your system, and the rather bacteria will go there to compete and then make use of that energy for you to start losing weight because you are not getting that energy or that nutrient that you need. And then it also can cause you to feel bloated, and it can also cause you to experience diarrhea, because normally what happens is that in SIBO, when bacteria acts on that nutrient in your small intestines, uh, the um, the breakdown of that food can lead to that diarrhea. I'm talking about the byproduct, the certain chemical that are released when bacteria acts on the nutrients in your small intestines. So that byproduct can then bring about diarrhea and then bloating. So that is actually the essence of SIBO, that is small intestinal bacteria overgrowth. All right. Now, let's now have a look at the symptoms. What are the symptoms? Naturally, we should put about 5, 6, 7 symptoms together. We shouldn't just take just 2, 3 symptoms and say you have SIBO, or that the small intestinal bacterial overgrowth. Now, the first symptom is loss of appetite. You don't have appetite. And then you have abdominal pain. Abdominal pain. That is especially after eating. You have abdominal pain, and then you feel nauseated. You feel nausea, and then bloating, and then of course you also feel very uncomfortable, feeling full after eating even something very little, not too much. So you feel. Like a pregnant woman, you feel full, your belly will be swollen like that because you have gas, unnecessary gas within the belly. And there is also diarrhea that can swap with constipation. There is one day you may have diarrhea, another day you may have constipation, and then a very significant symptom or sign is unintentional weight loss. So you may be losing weight that you don't really understand. Not that you plan to lose weight. No, you didn't plan, but you're losing weight. So that is also there. And another symptom is indigestion. So when you have indigestion, normally you may also experience heartburns and bloatness, and that you may also be passing gas, but not just ordinary gas, but very bad gas that would not be too pleasant for you. It's also another symptom is also belching. You may be belching. It's also quite typical of small intestinal bacteria overgrowth. So once again, loss of appetite, abdominal pain, especially after eating, feeling nausea, bloating, and then feeling uncomfortable. You have a swollen stomach or feeling too full after eating even a small meal. And the diarrhea that will switch with constipation and unintentional weight loss. And then you may also experience indigestion and then heartburn, and then, of course, excessive gas and then belching. These are quite common symptoms of Sibo. But now we're going to find out what brings about this, the causes and the risk factors, who gets it and why they get it. And then we will also look at the complications of Sibo, right? But before we talk about that, let me put a number on the platform. Maybe you have a digestive disorder, any form of digestive disorder or digestive disease. Maybe it could be Crohn's disease, or it could be IBS, irritable bowel syndrome, or irritable bowel disorder. If you have this problem, you can't digest your food well, you are losing weight unintentionally, you have wrinkles, you are not really aging gracefully. You see a lot of wrinkles on your face. It means that you are not getting the nutrients that you should get for your body. And just give us a call. This number calling outside the UK is +44 738 464 7300. Calling within the UK is 0738 464 7300. The second number calling outside the UK is +44 745 988 9152. Within the UK is 0745 988 9152. So just keep a call. And then if you have Sibo or any related problems to the digestive system, then of course give us a call, and then your life will never be the same. Maybe it's not you, maybe it's a friend or loved one. Pass on this information. Now let's come to the causes and risk factors. What brings about it, and then who gets it? And let's try to find out here. You see, the small intestines or the small bowel is the longest part of the digestive system. It's about 20 feet. That is exactly 6.1 meters. Those that maybe can figure it out, it's about putting about 4 people in a line, 4 people up. If you put them together, that is about 20 feet or 6.1 meters. Okay, so this really is the longest part of the gastrointestinal tract, all right? And that's what we're talking about there. That's where 90% of food, or that we have the nutrient absorbed. Is really very important to have that area to be okay, to be healthy. Unlike your large intestine, that the colon, your small intestine normally has relatively, as I was saying, fewer bacteria due to rapid flow of content and the presence of bile. Bile is produced by your liver. This is a greenish yellowish fluid that's very, very important for fat-soluble vitamins. So absorption of fat-soluble vitamins is so important. And so because of the presence of this bile, food or the content is supposed to flow rapidly through your through your small intestines. And so your small intestine is relatively clean area or clean place. The stomach receives food. It mixes with the acid and digestive juices, turns it into a clean, we call it a clean formation. We call it a chyme that pushes through the three parts of the small intestines, and where we absorb that 90% of our nutrients into the bloodstream to get into your cells or into your tissues. You see that the refuse, the garbage area is normally, of course, the colon or the large bowels. But the large bowels got also very, very important role to play, because that's where we have some water and fiber and undigested food are also, of course, dealt with there. So you get further activity there in your large bowels. All right, about in your large bowel, that's where you also get vitamin K, vitamin B1, B2, and B12. You see, taking for instance, vitamin K, all right, is so important for blood clot. So if you have any injury, the blood clot factor, this vitamin K, is so important to help stop the bleeding. Otherwise, you could bleed to death. So vitamin K is very, very important. There are some individuals that may experience nosebleed. And if you experience nosebleed, sometimes it could be lack of vitamin K. So you have to take note of this. And vitamin B12 is so important for our nerve health. So if you don't have vitamin B12, you go to a hospital and they do blood tests, they say you're lacking that. That's not the time to be taking the synthetic form of these vitamins. It's rather very important to address your digestive system. If you address your digestive system, then you can have all these relevant nutrients. You see, vitamin B12 for nerve health, if you don't have enough of vitamin B12, you have a tingling, a numbness, right? Because your nerves will not be healthy, and then of course your legs you feel weak in your legs and numb. That is quite typical. Except those that are also they have diabetes. If you have diabetes, definitely it damages the nerves as well. So if you have diabetes and you have Sibo, you have a double problem, because both conditions can then lead to real problems of nutrient problem or nutrient depletion. Now, let's come to now the causes here. The first cause is a complication of abdominal surgery. If you had an abdominal surgery in the past, it may cause this problem, the Sibo. There's also structural problems in and around your small intestines. Structural problems, excuse me, can be this what we call the diverticulosis. Diverticulosis can be some small holes or sacs in the walls of your small intestine that can cause some structural problem. That is a risk factor indeed. And then also a weakened immune system. You see, 85% of your immune system is in the digestive system. So if you have a weakened digestive system, you automatically have weakened immune system. So that weakened immune system can lead to Sibo. And then another cause is low levels of stomach acid. So low levels of stomach acid naturally can lead to also Sibo. So with age, we don't have too much acid as some people may think, but we rather have low acid. So we should find ways rather to increase the acidity in the stomach, right? Good. Now, when we move on, who gets this one? Sibo, the risk factors here. I've mentioned the diverticulosis already. Now we're talking about Crohn's disease. Crohn's disease is also a very serious inflammatory bowel disease that can affect the intestines. And then we also have another condition called intestinal lymphoma. It's also a disease that affects the intestines. And then if the person had or might have had a history of radiation, it can also cause this problem. the individual that has diabetes. Diabetes is a single disease that can cause very serious digestive problem. That diabetes is something that you cannot control. Always, those people that are controlling sugar level, you are doing nothing. The longer you harbor this disease, the damaging effect that it can have on your whole system, especially your digestive system. All right. We have what I call the hypochlorhydria. Hypochlorhydria is simply low stomach acid. If you have low stomach acid, that can also lead to Sibo. I've mentioned that already. And nerve damage, we call that peripheral neuropathy. Peripheral neuropathy can be caused by the same diabetes. So if you have diabetes, it can cause nerve damage. And nerve damage is nerves are very important for the movement of our intestines. So if you have nerve damage, your intestine cannot move well, and the food that should run smoothly and rapidly through your intestines will be moving very, very slowly. And as they move slowly, they give the bacteria in your colon the opportunity to feed on that nutrient. And that can be very, very, very serious. That can lead to low energy and, of course, unintentional weight loss. And another cause or risk factor is liver cirrhosis. It's severe scarring of the liver. That's a liver cirrhosis. Severe scarring of the liver or poor function of the liver can also lead to Sibo. So it's very, very important. If you want to have a good digestive system, it's very, very relevant to have good liver or healthy liver. Always, I ask my clients, when did you last cleanse your liver? They have no idea how to cleanse your liver. If you have no idea how to cleanse your liver, please just be in touch with me. Cleanse your liver, cleanse your organ system, cleanse your blood system, and I tell you, you'll be on the road having very, very good health. Another risk factor here is what we call the hypothyroidism or hyperthyroidism. If you have thyroid problems, then of course you can also experience Sibo. So you see, thyroid problems can lead to digestive problems. You see where we're coming from. The whole body is connected. This thyroid is a small organ just under in your neck. And if you have a disorder, it can affect your digestive system. Those individuals that have HIV, they can also have a gastric problem because HIV is all connected with the immune disorder. So definitely, if you have a low immune system, naturally you will have a problem with Sibo as well. A condition called fibromyalgia. Fibromyalgia is a chronic syndrome that causes bodily pain and mental distress, and that can also lead to Sibo. And then chronic fatigue syndrome. Those individuals that they are always tired, it can also be a risk factor for Sibo, small intestinal bacteria overgrowth. And those individuals that may have heartburns, they go to hospital, they are given antacid. You see, if you're given antacid, just because if you have heartburns, you can have more serious problems with the digestive system. So antacid, antibiotics, painkillers can cause Sibo, can be a risk factor for Sibo. And then those that drink excessive alcohol can also have that problem. Another risk factor is naturally aging. Aging doesn't cause actually Sibo, but when you are aging, the acid in the stomach will be reducing. And that is the whole problem. And the digestive juices can also reduce. So when you are aging, it's very, very relevant, really very important to increase the digestive juices. Do things, support your digestive system with the nutrients, and then also increase the acidity. We have ways to do that. That's why it's very important to contact me if you have digestive disorders, because there is a way, there's a natural way to solve this problem. Don't go and take any synthetic medication to worsen your condition, really. And individual with a pancreatic disease, if you have a pancreatic disease, it can also cause this be a risk factor for Sibo as well. We have what we call IBS. IBS is irritable bowel syndrome or irritable bowel disease. It can also be a risk factor. Parkinson's disease is also a risk factor for this, and obesity is also a risk factor for that. what is actually, or what are the complications? What complications entails SIBO? It's very clear. If you see yourself aging, aging very quickly, having wrinkles on your face, on your skin, you know that you are not getting the nutrients you need to get in your body. God actually created us to age gracefully. But if your digestive system is weak, you see, both health and death comes through the digestive system. So if your digestive system is great, you will absorb the nutrients that you have strong immune system. You can also, age beautifully or gracefully. So one complication is unintentional weight loss. You'll be losing weight that you don't understand. This is quite a typical problem. That individual may be switching diarrhea with constipation. One day the person experiences constipation, another day the person experiences diarrhea. So you may have this experience all the time, and your life can be very, very miserable, not happy one. And then another complication is depletion of vitamins or vitamin deficiency. That's not the time to purchase synthetic vitamins. They will not help you. What I believe in naturally is that eating these colorful vegetables, dark green leafy vegetable, they contain all the B family, B1, B3, 5, B7, B12. They contain all the vitamins that you need, and the colorful ones. But you need to have good digestive system. You need to have good or healthy small bowel system, or the whole gastric system, so that you can absorb naturally all these nutrients to age gracefully. But then if you take the synthetic one, it will not help you. If you're lacking, example, vitamin B12, you will then have problems with weakness, fatigue, tingling, numbness in your hands and feet. Normally, this is quite typical, but this is not the time to take synthetic vitamin B12. It will never, never help you. Another complication is kidney stones. That individual may also have kidney stones, and if you are not careful, it could lead to kidney disorders or kidney failure through this. And then another complication is poor calcium absorption. And that may also be because of this, can lead also to kidney stones. Well, so today, you see, we've learned a lot. This is a true knowledge, actually, that we've learned about SIBO, that is small intestinal bacteria overgrowth. And please, if you don't want to miss such beautiful programs, in between Thursdays, Sundays, between 8 and 9, we have also a short. I also produce some short programs, 5 minutes long, very, 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 very important. If you don't want to miss it, please visit us on YouTube. Put in Dr. James Natural Link, Dr. James Natural Link, and please subscribe, okay, and then press the like button, and then so that you will never miss this program. Please share this video when you also see this, and then be a blessing to someone, and God also will bless you. Thank you very much today for tuning in, and we're going to have a wonderful experience this coming Sunday as usual with